All right, it is 6:05. Perhaps we can get started now. Senator Sear, are you ready to begin?
You bet.
All right, well, welcome.
Thank you. Y'all can hear me? We're good?
Yes.
Awesome. Good evening. My name is Julian Sear, and I serve in the Massachusetts Senate. I represent 20 communities across Cape Cod, Martha's Vineyard, and Nantucket. I'm the Assistant Majority Whip in the Senate, and I'm the Senate Chair of the Joint Committee on Mental Health, Substance Use, and Recovery. And welcome this evening to a season of change, coping during COVID, a virtual town hall event presented by the Cape Cod COVID-19 Response Task Force and the MassSupport Network. We have been partnering, and tonight this event is going to focus on the psychological effects of the challenges faced during this time, and are going to offer helpful coping and self-care practices and strategies. And we also have an opportunity to provide a Q&A, question and answer, for attendees with local health and human service experts. So the event is being streamed live on the MassSupport Facebook and also on the Barnstable County Facebook. The event will be recorded and available to access going forward. The Cape Cod COVID-19 Response Task Force was established as a collaborative effort to bring together all the stakeholders in the region to address the pandemic and to work in a collaborative fashion. It includes and is led by the Cape and Islands Legislative Delegation, the Cape Cod Chamber of Commerce, Barnstable County government, with participation from Cape Cod Healthcare, community health centers, municipal officials, first responders, community leaders, and others. The MassSupport Crisis Counseling Program is our partner here in tonight's event. MassSupport Crisis Counseling Program is managed in partnership by the Department of Mental Health and Riverside Trauma Center, which is a program of Riverside Community Care. Here on Cape Cod, we are fortunate to have outstanding organizations who help people in all sorts of time, but have particularly been helping people to navigate these last challenging 11, now going on 12 months. And so we have local experts here, and at the end, they'll be able to answer questions on a number of topics. So we have with us tonight Cassie Danzel, who's the Vice President of Programs and Client Services at Housing Assistance Corporation. We have Lorraine Ward from the Department of Transitional Assistance. She is the Deputy Director for SNAP Outreach and Nutrition Education. We have Dickie Hansen, who's the Director of Clinical Services from Outer Cape Health Services. We have Terry Ann Morin, who's the Director of the Family Resource Center. And we have Lori Cantor, who's the Director of Integrated Services from the Community Health Center of Cape Cod. And all of these organizations have been so essential to helping keep people afloat in this really difficult time. You don't need to hear from me what a trying, challenging period this has been. I certainly could use some coping and self-care strategies myself. Definitely feeling this 12 months in, particularly given this latest several weeks and months with this botched vaccine rollout. But we're working hard to right the ship. And I feel really blessed that we have such dedicated, wonderful people here on Cape Cod working to get us all through this. We're only going to be able to help other people when we're able to take care of ourselves, and that's an important lesson. Certainly, I try to tell myself I certainly rely on outpatient mental health care to help me do the job that I did. I actually had therapy finished up therapy just before joining tonight's call, and I think it's really important that all of us talk about talk about self-care, that we talk about mental health, our needs, and our own mental health care as we're able to. I think it's really important, particularly for those of us who are in leadership roles in our community. So I really want to thank you for dedicating a little bit of your time on this Wednesday night to being here with us today. A few housekeeping notes before we get underway. So all participants will be put on mute. If you have a question, we ask that you put it in the chat box, which will be monitored. And then questions will be addressed in the Q&A portion of the program. So with that, I'm going to turn it over to Larry Berkowitz, who is the director of the Riverside Trauma Center. Larry is the co-founder of Riverside Trauma Center. He has provided direct therapeutic services for over 20 years and has managed mental health services for over 15. His clinical expertise include work with children, adolescents, adults, and families who are trauma survivors and or suicide providers. Larry holds a doctoral degree in counseling and consulting psychology from Harvard University and is a licensed psychologist in Massachusetts. He's on the executive committee of the Massachusetts Coalition for Suicide Prevention, serves as the co-chair of the Northeast Massachusetts Coalition for Suicide Prevention, and holds an appointment as a teaching associate in psychology part-time at Harvard Medical School's Department of Psychiatry. So I'm going to turn it over. I really want to thank Larry for joining us tonight and the tremendous work that Riverside Trauma Center does across the Commonwealth. Thank you again for being here. And Larry, turning it over to you.
Thank you, Senator Sear, and so glad to be with all of you. And Senator Sear, let me start by saying thank you for your terrific role modeling and leadership. What you just did moments ago is critical. It's for all of us to be able to say, yeah, I need some support and help, and to not have any shame about showing that. That's how we're going to get through all this, right? I'm jumping ahead to say this, but I wish from the start they hadn't talked about social distancing. The last thing we need is to be socially distanced, right? We need to be physically distanced, but goodness knows what we need more than anything is social connection, but we'll get to all that. So, but thank you for role modeling that we need to talking about this stuff and how we're getting through, because it's not easy for anyone. So glad to be with all of you. As you've heard, Riverside Trauma Center does work around the state, helping communities recover from highly stressful events. We are proud to work with the Department of Mental Health in Massachusetts with funding from the federal government to provide this crisis counseling program. You'll hear more about that as we go through the evening, the MassSupport program. But just historically, we've done lots of work with communities on the Cape and both of the islands over the years in helping communities deal with mental health and wellness and suicide prevention issues. So glad to be with all of you tonight. I am going to just get a couple of things started here. I'm going to share some slides as I go through my presentation this evening. And let me just get that set up. If there's one thing I think that all of us have gotten pretty accustomed to over time this year, it's been figuring out how to be patient and figure out the technology, right? So now, unfortunately, my Zoom bar is in the way of the control that would allow me to switch so that you can see the whole thing. So bear with me a second. I'm going to try that again. Sorry about this, folks. Yeah.
I think if we click on the from the beginning icon on the far left, it will give you the full slide. Next one over.
Yeah. Well, but you're not seeing the slide covering the full picture, right? The control that would allow me to get to that is covered, but all right, we'll just move through, and I'll ask for your patience with this. So if I talk tonight, my plan is to talk a little bit about stress, uncertainty, how we cope with that, and some on resilience. And you'll be hearing more about resilience later as well for the evening. Now, we could talk about all the mental health issues that people are concerned about popping up. I don't want to depress you by spending half an hour talking about all the concerns and worries. They're real. We know that some people are struggling more than others, and there's an incredible range of the ways in which we're all reacting to everything that's been kind of thrown at us during this past year, right? So my primary starting point is to talk about stress a little bit with you. So actually, let me ask you just quickly, jot an idea or two in the chat box, and we'll ask Beth and some of the other folks to just read a couple of come ups. When you hear the word stress, what comes to mind? What is stress? What does that mean to you when you hear stress? Let's get a couple ideas out there.
We have some saying worry, can't sleep, counterproductivity, anxiety, overwhelming problem, pressure.
Exactly. Thank you. Yeah, exactly. All those things are good examples of stress. And what stress is this incredible range of reactions that we get that are really, they're physiological, right? They're in our bodies. And it's part of it is the way in which we perceive it too. So it's both subjective and sort of part of how we think about things, but it's also what we're feeling. It's in our bodies. It's a normal physical reaction to the demands that are placed on us, to perceived threats. And we all know, and probably all of us have experienced this, that there's a range of threats. If we had stress, if we had no stress whatsoever in our lives, while that might sound appealing, we really wouldn't be much motivated. It would be kind of, our lives would just feel boring. People would rust out if there was never any sort of a little bit of adrenaline or a little bit of incentive to move us along. Now, too much stress, and we all know what that is, right? That's just too extreme. And we kind of burn out if we're under lots of stress all the time. For each of us, there's this optimum level of stress, and that's where you see the curve going up, right? And too much, it starts to come down again in terms of how much we're functioning and how well we're functioning. And for all of us, that point where we're at our best changes. It's different for everyone. We know that about kids in school. We know that about us as adults. And we also know that at a certain point, we all have a good sense of it, probably for ourselves. When it starts piling up and gets to be too much, that's when we start not responding well, right? Sorry. There are a couple of types of stress, three types of stress that we think of. There's a positive stress, which is the good stuff that happens in our lives. It's even a little stressful. You're planning a wedding, right? There's stress in that, right? But it's a positive stress. We know the outcome is going to be positive from that, hopeful. There's tolerable stress. All of us can think probably about work, family, home life, the kinds of things that on a day-to-day get our heart rate up a little bit, but we know how to manage them. It kind of keeps us moving day to day. And then there's something we call toxic stress. And toxic stress is when the demands just keep overloading us day after day after day, to a point where it's really impacting our body, and our ability to cope well, it starts to decrease. So trauma is an example. Something that's traumatic is an example of toxic stress. And it's this intensity level that we're talking about, right? It just feels overwhelming. It's hard to manage, and leads us to feel this sense of loss of control. Things are getting out of control around us, that we start feeling vulnerable, that bad things could happen to us or the people we love, and we worry about that. And a sense of just being immobilized, that we can't move, that we can't function, we can't respond well to what's going on around us. And I think all of us could probably identify with different levels of those that have been going on for us over the last few years. And as we think of this related to the pandemic, I think two really important points come to mind. And one is that in terms of the demands on us and the stress, it's pretty clear that the long-term impacts of the pandemic and this changing situation that changes day to day and week to week are not evenly distributed. We know that. We've been reading about it. We've been experiencing it, right? Some of members of our community are differentially impacted. Some of us are lucky enough to be working from home where we can feel safe every day, or safer, and some folks are having to be out and working in our grocery stores and in the medical centers and are exposed to more risk, right? We know there's differential and there's variability in it. And we know that the important messages that we're getting around coping with and dealing with the pandemic, with the virus, and this comes from science, is that we know that we have to find ways to support one another, right? We keep hearing that we're in this together. We know, and there's been, our grandmothers knew this, but there's plenty of good research and evidence that supports the idea that good, strong social support is what really helps people get through potentially traumatic situations, helps people get through high toxic stress periods. Now, and as I said at the beginning, that's contradictory to this message we're getting to socially distance, right? It's about physical distancing. So we've got to figure out, we've been working on this for a year now, as Senator Sear mentioned, and I don't know about the rest of you, but it's kind of blowing me away that we've been at this for a year now, right? And hopefully things are getting better, but we are trying to figure out, how do we support one another? How do we build in those supports? And that's what we'll be talking about a little bit more as a way of countering and dealing with and coping with the kind of ongoing stresses that we're feeling. Well, the primary way we talk about it at the Trauma Center, at Riverside Trauma Center, and we've been using this through in our conversations with MassSupport, is to think about when we think about what helps us with this uncertainty that we've been dealing with the stress that we've been dealing with. These three key principles are what seem to be most effective at helping us in getting by and getting through. And those principles are thinking about, how do we find safety, predictability, and control. Safety, predictability, and control. Let's dig into that a little bit. What do we mean when we're talking about safety, predictability, and control? Well, safety, some of that's the concrete physical safety that we're talking about. This is the stuff that we're talking with our family members, our coworkers, our kids about, right? About staying 6 feet away from people as best we can, the physical distancing, wearing our masks, right? This is going to help keep us and our families and the people close to us safe, right? We want to find ways of reducing harm, reducing our exposure to things that could get us emotionally dysregulated, emotionally upset, right? Some of that might even mean things like making sure we're limiting how much we're watching news about things that are distressing us and upsetting us, right? We're looking for ways to find emotional safety, physical safety, and safety within the relationships and our social networks. We're looking for predictability. How can we continue to build into our lives, as best we've been doing and can continue, consistency, right? How can we build structures and routines? How can we build a sense that our lives are as organized as we can make them right now? And what are the things that we control? What are the things we can control? And how can we look at those and build in ways of making sure we're managing the things that we can, the best that we can? So for each of those, what are we talking about during COVID-19? Safety, physical safety, right? We're trying to follow the best information that we can, right? Keeping in touch with the information that's coming out from the Massachusetts Department of Public Health, the Centers for Disease Control. What's the information that we're getting that's telling us how, and this is evolving and changing, right? We knew that at the beginning, the messages were different. As science and the people who are on the front lines are learning, we want to keep up on that information. Some great resources out there. What's one that I particularly like, John Hopkins has a great website with good information, CDC, Mass Department of Public Health. So let's make sure we're finding ways to keep ourselves safe by keeping up on what's current information, right? Minimizing harm, finding out ways to stay on top of getting good information about income, resources. That's part of what tonight's about, right? Knowing who the resources are in our communities that can help us stay safe and get connected with the organizations and the people that can help us get through this and continue to get through it as it's ongoing, right? When we talk about predictability, what are the rituals, routines, our family routines? Hopefully by now we've got some rhythm going to these, that we're still getting up, even if we're working from home and schooling from home, we're getting up and having breakfast and brushing our teeth and taking showers and doing our routines and keeping them as consistent as we can. Building schedules for ourselves, making sure we're keeping with those as best we can. Trying to get to bed at the same times, getting up roughly at the same times. These kinds of predictable schedules in our lives can actually help provide the structure that we need to get through and manage and mitigate stress. And how do we manage to build in some control? Well, that's hard, that's challenging. A lot of things right now are out of our control. But one of the takeaway messages we hope that we can talk about, and as we think about how do we cope, how do we manage, is that we may all be vulnerable, but we're not powerless. There are things we can do. right? So we can, as we've talked about before, we can continue to follow the safety messages. We can think about how do we give ourselves and our family members, our children, our students if we're teachers, how do we give people choices, right? You know, we may not have a lot of things we can do, but we can choose to go out for a walk or to get out of the house, to get out in the sunshine. We can choose to do that, or we might choose to continue to do some exercise at home. What are the choices that we can set up for ourselves, our families, our kids? And really important message is, how do we focus on our strengths? What are we doing well? One of the ways to remain in control and to remain resilient, and we're going to talk about resilience in a moment, is to really try to focus on what are we doing well, what's getting us through, what have we done in the past that helps us, what is working, what's continuing to work. How do we focus on what we're doing well and what the people around us are doing well? Because we're really in this together. If we can comment on that with each other and admire what other people are doing to help get through right now, that's going to help them, that's going to help us. This idea here of providing small islands of mastery. What are the things that we do that we can notice, that we can pay attention to, the things that we do well? We've all got some things, right? Let's build in some time, if not every day, each week, you know, to just do a couple of things that we know we do well. Maybe that's connecting with other people. Maybe that's our exercise routines. Maybe that's something you do at work that you know you do well, and just pay attention to it. We're all going to be having reactions. We're all reacting to this stuff. Stress means we have reactions. We all have feelings. But having those feelings doesn't mean we've lost control of ourselves. It's acknowledging them, noticing them, and figuring out ways to build in those little bits of control that we can continue to have in our lives. So here's one. I wish I could make this one large. And again, my apologies that we can't. I got back to that. That didn't do it. Sorry. I was hoping I could make this one larger, but I can't. I love this. We came across this on somebody's Facebook page. It's a list of the things, and do this for yourself, really. Draw your own image, the things that you can't control and the things that are within your control. And here, you know, the things that are not in our control, or, you know, it says, I don't know if you can read this, it's probably too small. If others don't follow the rules of social distancing or physical distancing, we can't control the actions of others, right? We can't predict what's going to happen. These are the things that are outside of our control. Those of you who are in the substance use community or 12-step programs are familiar with the Serenity Prayer. This reminds me of the Serenity Prayer. What are the things that we have control over, the things we don't, and give me the wisdom to know the difference. What are the things we can control? And let's focus on those and pay attention to those, right? If I'm getting overwhelmed by watching what's going on in the news, let's turn that off, right? I know for me personally, I do better if I read the news in a newspaper than if I'm watching on TV. It's just a little less stressful for me. So I'm trying to do that a little bit more, right? Can I find things that are fun? Can I create some way of paying attention to what the things I'm grateful for around me, and really paying attention to those every day? That doesn't mean I'm not stressed. It doesn't mean things aren't difficult, but paying attention to the things I'm grateful for, paying attention to the beauty that's around us in the world. You know, the places that you live on the Cape and the islands, there's plenty of natural beauty. Let's pay attention to those and appreciate those kinds of things. These are the kinds of things, and there's evidence. There's evidence behind these simple tactics. These are the kinds of things that get us through high stress and help mitigate high stress. You've heard me mention the term resilience. Just want to talk about that briefly. What is resilience? Actually, let me ask you, when you hear that term resilience, what does that mean to you? Let me ask you to type in again, and we'll ask Susie, maybe you could read a couple of the responses people are coming up with. What does resilience mean when you hear that term?
We've got grit, optimism, capacity to bounce back, stamina. Got a few bounce back.
Grit, bouncing back, resilient, like a rubber band, right? You get that idea in mind, that vision, yeah. Yeah, it is really about, there are a number of definitions. It's It's about a positive, adaptive approach. People who are the most resilient are the ones who have this overriding sort of positive worldview that gets them through. And this is not something we're necessarily born with. This is the kind of thing that we can develop, that we can focus on, that we could choose as a way of approaching things. It's kind of like we've been talking about, how do we focus on the positive? Yeah, it's not denying that things are difficult. It's acknowledging that they're difficult and focusing on what I can do, what I have done, what are the attributes, the attitudes I want to take that are going to get me through it. And when we can do this, this helps transform stress from being toxic stress and really running us down into being tolerable stress, the kind of stress we can manage and deal with, and particularly when we're dealing with it with other people. It's a process of adapting in the face of adversity. It's adapting to threats. It's about using our relationships, our family, to solve problems. Here's that term, bouncing back, some of you talked about, right, from difficult experiences. And that's the American Psychological Association's definition of it. It's, that was actually up there. And this list of fitness areas comes from Donald Meichenbaum, who is a very well-known psychologist. He helped develop the field, one of the leaders in the field of cognitive behavioral psychology, cognitive behavioral therapy. He talks about resilience as having several different areas. And these are the things that we can practice and build in, right? So physical fitness helps us stay strong. How do we take care of our bodies? Because remember at the beginning, I said something along the lines of a lot of this is in our bodies, right? This stuff lands in our bodies and is centered in our bodies. Can we make sure we're doing our best to get good sleep? And sleep can be challenging at times, right? Especially when under stress. Can we go to bed around the same time every night? Are we avoiding screens, right? Are we avoiding the light from TVs and our computers and our screens for an hour or so before bedtime? Are we in good routines around that? Are we getting outside? Are we, we don't have to start training for a marathon now, but we should be doing whatever we can to stay somewhat physically active to help our bodies stay strong as they can. This interpersonal fitness, let's make sure, even if we're, social distancing, physically distancing, let's make sure we're staying connected to people. That's so important. Our families, thank goodness we've got the technology. It's not ideal. I don't know about the rest of you. I'm a little sick of using Zoom day after day after day, but I'm still on the weekends doing my best to, to have a schedule of getting in touch with family and friends, of making sure we're staying connected. That's really essential, right? And once we can get back outdoors more, making sure we're getting out safely with other people, visiting, walking with them. This area, emotional fitness, what does that mean? That's, what are the things that we can do to focus on positive emotions? How can we use humor to get us through tough times? Can we give ourselves permission to not be okay all the time, to acknowledge that we're going through challenging times, and to recognize when it's getting to the point where we need extra help and to not feel shame or embarrassment about that? Again, kudos and thank you, Senator Sear, for identifying the resources we have around us. We've got good systems and supports. And whether that's called, if we get to a point where we need a mental health professional or our pastoral counselor, or, turning to our community supports, let's make sure we're doing that. This is an example of how we become and maintain resilience, paying attention to these things, building them in. There's this thinking, cognitive fitness areas. That's about being flexible, right? We're learning that, aren't we? And having to coach ourselves to be flexible. We're being flexible around the technology. I wish right now that the technology I had in front of me was working properly. It's not, and I'm hoping that you're all being flexible and good-natured about the fact that this slide might be a little hard to see, right? How can we keep things in perspective? That's what this cognitive thinking flexibility is about. Behavioral fitness, that's another area for resilience. How can we do our best to, really push through our own, whether that's procrastination or developing our routines that we talked about before, the predictability, right? Safety, predictability, and control. How can we build those things in? How can we plan Maybe this is keeping our things to do list, setting goals for ourselves and really trying to accomplish them within reason and being flexible, right? And paying attention to our spiritual worlds and lives. This is a really important time to do that. For those of us who have some form of spirituality in our lives, let's really use it. Let's turn to it. Let's pay attention to it. So you see, there's a lot of ways that we can build resilience. And maybe we're not paying attention to all, 6 of those areas or 5 or 6 of those areas, but maybe we can be building in some ways in some of those areas to be really trying to take care of ourselves. So what does this come down to? The takeaway message for me is in this cartoon, which is a person standing looking at a brick wall, right? And the sign on it says, "Welcome to another one of life's brick walls, standing squarely in your path. Please select from the following options." And what you see here is over, under, around, through. Am I going to select the wings to get me over this wall, the shovel to dig under it, the boots to hike around it, or the sledgehammer to try to smash through it? And that's really what problem solving in a time of high stress and uncertainty is about. They keep piling up, the challenges, right? But the way we can be resilient is to really keep asking ourselves, to acknowledging this is tough, but to say, all right, what can I do? What can I and my friends do? What can I and my family do to problem solve, to manage yet another challenging situation? So I want to stop there. And I know I just ran through a lot of material pretty fast. I'm going to take a breath and introduce you to our next speaker, who is Elizabeth Rago. And she is working with the MassSupport program. She's the team leader for our Southeast team, which covers the Cape and Islands in the southeastern part of the state. Liz is a proud mother of 3 daughters. She's a recent graduate of the Boston University School of Social Work and has earned her master's in social work degree. She's had experience prior to coming to MassSupport working with people who are chronically homeless as a case manager. She's worked with folks who have substance use disorders. She's worked as a counselor in an inpatient facility. Liz speaks Portuguese as well as English and is passionate about working with survivors of trauma, especially those who speak English as a second language. So Liz, let me turn this over to you.
Thank you, Larry. Thank you so much. Good evening, everyone, and thank you for joining us. I'm going to discuss a little bit about MassSupport, our crisis counseling program, and what we have to offer for residents of Massachusetts. So given all the changes and uncertainty and loss associated with COVID-19, we know that we as a community are concerned about our children, families, and loved ones. We would like to offer some assistance. MassSupport Network provides free community outreach and support services to youth and adults statewide. Our crisis counseling program is a partnership between the Department of Mental Health and Riverside Trauma Center, and it is funded by the Federal Emergency Management Administration, also known as FEMA. MassSupport Network services are free, confidential, and anonymous. We provide individuals of all ages and families with up-to-date information, emotional support, and a variety of resources to meet both basic and higher level needs, coping strategies, and more. The network has a diverse multilingual team of Mass-based outreach counselors, clinicians, certified peer specialists, and recovery coaches, solely dedicated to serving your region. We also offer consultation, group support, and psychoeducational presentations to schools, businesses, and organizations. We can be followed on Facebook, Twitter, YouTube, and Instagram as well. I would like to go ahead and leave our statewide assistance line, which is 888-215-4920. That line is open from Monday through Saturdays, 8 a.m. to 8 p.m. Again, Monday through Saturday. And the way it works is there is a voicemail set up with different prompts, and someone can call in, and one of our team members we'll be able to give the individual a call back. So on behalf of the Southeast team and all of MassSupport, I'd like to thank you again for having us here, and best wishes and good health to all. Now I'd like to introduce one of my outreach crisis clinicians who works for the Southeast team. Her name is Colby Andrade, and Colby is a recent graduate from Bridgewater State University, where she earned her master's degree in social work services and has worked in multiple settings, such as community mental health, substance use treatment, homeless shelters, children, adolescent residential treatment, and mobile crisis. We're very grateful to have Colby working for MassSupport, and she will be discussing remaining resilient during challenging times.
Thank you so much, everybody, for joining us tonight. I'm very excited to be here with all of you, and I'm hoping to discuss some techniques on self-care. Next slide, please. All right. So Larry talked a little bit about resilience, but I'm going to share this quote with you. So the ability to bounce back to life, returning stronger than before, is a vital component to our health and well-being. Rather than being overcome by perceived failures, missed opportunities, or issues beyond our control, people who are resilient are able to find a way to carry on and thrive. Next slide, please. So what are some key factors that contribute to resilience? So one is being able to self-regulate, knowing how to calm yourself down when you're upset, knowing how to lift your mood when, you know, things are really kind of feeling like Groundhog Day, the same day after day, living in a global pandemic. It's being flexible while still having healthy boundaries with yourself and others, knowing when to say no, not biting off more than you can chew, maintaining a positive outlook. So finding those small silver linings on a day-to-day basis of, you know, well, what went good today? What is something that happened today that I was in control of and that, you know, made me feel good? It's supportive communication skills. Again, going along with boundaries is maintaining those boundaries by using communication, like I said, saying no, or, you know, if things have been very repetitive, maybe you do decide to switch it up and do something different. Seeing failure as an opportunity to grow. And these qualities can help us accept, change, adapt, and keep things in perspective, which will help us take good care of ourselves. Next slide, please. So being resilient doesn't mean that you never feel discomfort or experience distress or heartbreaking life events. In fact, often the road to resilience is paved with adversity, trauma, and a great deal of emotional dysregulation. So it is important that we develop strategies and relationships that sustain our overall well-being and capacity to build resilience when met with challenge. Next slide. Thank you. Now I'm going to talk a little bit about the 3 R's of self-care. So reflection, regulation, and relaxation. So reflection. Reflection is really about noticing your reactions and patterns, which allows you to plan for how to engage in intentional self-regulation and self-care. Reflecting on what you and the people around you are doing and systems you're working with, your relationships with them, and what support you might need is a vital part of reducing the impact of stress. So sometimes when you have a lot of stuff going on, it could be helpful to really say, like, what do I need right now? You know, maybe I should check in with a friend. If you've been working a lot and you've been very overwhelmed, maybe checking in with your supervisor, things like that, a coworker that you trust, and just kind of giving yourself that same care that you would give a friend, attending to yourself the same way that you attend to others in your life that you care about. Planning for how you can healthily cope with the impact of toxic stress. You know, today was a really hard day. What can I do tomorrow to lessen that load? Next slide, please. So regulation is about the way you choose to respond in the moment when you start to experience a stress response. Remembering that the people around you are also experiencing intense levels of stress. People in your life may also have strong emotional reactions, and remembering that these emotions are contagious. Knowing what your own trigger points are, what activates you, what upsets you. Practicing catching and releasing your own defensive reactions and having some compassion for any self-protective tendencies. And most of all, noticing when you are reacting, stopping to take some time to calm yourself when you do get angry or hurt, asking for help and debriefing when necessary. Relaxation is about keeping yourself strong and balanced. So finding that balance in your life, making time for yourself to relax and play, whatever that means for you. Maintaining and developing your social support system and your sense of humor. It's totally okay to laugh with all of the uncertainty going on in the world right now, doing those things that make you feel comfortable, making you feel like yourself again. Being gentle, patient, and realistic with yourself. And that's all I have for you tonight. Thank you so much.
Okay. So this is Beth Albert. I guess this is where I come into the question and answer. We haven't had a tremendous amount of questions for our local experts. However, we did have a question about if someone calls MassSupport, if they call the 888 number, what happens to that person when they call? If maybe Liz or Larry could talk through like what actually happens when someone calls there and leaves their name and number.
Yep. Do you want me to do that, Larry, or?
Please, yeah.
Okay, so the line is open from Monday through Saturday, 8 a.m. to 8 p.m., as I said before. And what happens is it's a voicemail that is prompted, and you go ahead, you leave your name and number. Some people just leave their name and numbers. Others go ahead and just leave a detailed, a short detailed message on why they're calling. And yes, folks do sometimes call because they are in need of some emotional support. And we are so grateful and blessed that we have been trained in psychological first aid and skills for psychological recovery. And our counselors are available, again, Monday through Saturday. What happens is one of the team leads takes the call, we triage that call, and then we go ahead and send it out to one of our crisis counselors or clinicians that are available that day. The individual will receive a call within an hour. And I'm also proud to say that we have, again, bilingual folks. So we have a lot of folks reaching out in different languages that are in need of
Liz, you're picking up. Liz.
Yeah. Yeah, Liz, I'm afraid we're losing you there.
Emotional support as well. Can you hear me now?
Yes.
Now,
Okay.
yes, but you've been breaking up. Yeah.
Sorry. So this is no way a long-term therapy session, but we definitely can maintain some connection with the individual for some short times. We've done this for, sometimes we keep in touch if the person would like for about a week or so. And then if the individual is in need of more, we can also become a bridge to finding that resource for the individual.
Okay, we have a follow-up question on that, but it's how do we best weave MassSupport counseling services into the behavioral health provider services we already have on Cape Cod? Can we build workflows or communication trees to facilitate collaboration? I'm not sure if that's a Liz or a Larry question.
Probably all of us could answer it, but I think that, in the spirit of, we're here to extend and help support the existing resources in all the communities around Massachusetts. So, if people start with us, our hope is that, we'll soon, we don't, as you just heard Liz say, we don't do any long-term work with folks. We'll try to figure out what's helpful, what's going on, help acknowledge things for people, help them do a little brainstorming, and let them know about the resources that are in your community so that we can help refer them to them. And, you might want to, in your settings, let people know about MassSupport as a resource that they can call if they need just a little additional support or extra support. I really think of it as a back and forth, that we're supporting each other. But our ultimate goal is to make sure that we eventually get people back to the resources in their communities, to you folks.
Yeah, and I'll just add on to that. Liz, when we first connected, that was one of my primary concerns, is that she was really well integrated into what the resources on the Cape. And so I have made myself available to her and her team to make sure that she's connected to the, to all of the great organizations that are on the Cape.
Mm-hmm.
So thank you for that question.
Yeah. Actually, if I could just extend that. So I think that's a great point. So example, maybe, folks from SNAP, the nutritional program, are talking with folks and they hear, this family's a little stressed out or something. It doesn't rise to the level that they need, family therapy or more intensive counseling, but they're dealing with some stressors and it might be helpful for them to talk to someone. Then that would be a great call for us. We can meet with them 1, 2, 3 times, maybe help them manage a couple of things that have come up for them.
Excellent example. Thank you, Larry. One question, and I'm going to, I guess, start with you, Larry, but then I may ask some of our expert panel to weigh in, is how do you maintain your social supports during the isolation that comes with COVID? It's a great question.
Yeah, that is a tough one, isn't it? And I think it's been hard for all of us, hasn't it? Yeah. And for some people, it's easy to fall back and fall away from that. I think we have to really do our best to find ways to do that, to make regular phone calls to people, to use, we've been meeting with it, I'm on Zoom all day, and so I don't often like doing it, but every other Friday night, my wife and I get together with a group of friends that are around the country that we usually meet with once a year. And now we've been meeting with them every 2 or 3 weeks and building it in and scheduling it at the end of each time we're with them, scheduling the next Zoom call. Can you go for walks with people, where you're both wearing masks and you're being careful about distancing on the weekends, finding some places that are open enough when outdoors. It's really about scheduling it, really thinking it through and making sure, I make a point for myself, in addition to those kinds of calls, of saying I need to reach out and call every weekend, at least one extended family member or friend. It's building in these kinds of strategies for yourself to make sure that they're there. And I'd also say to you, think about the people around you who you're not hearing from that you might usually, because maybe that's a sign that they're struggling a little bit. And it might be just as important for us to reach out to them to say, how you doing? You okay? Let's talk.
Thank you, Larry. That was really practical, great response. I was going to see if Dickie from Outer Cape Health had anything to add. If you don't, that's fine too, Dickie.
No, I just want to tie together what Larry said about that in terms of resilience versus reaching out. And that is the people who are resilient are the ones that sort of pushes themselves through. Even though I don't want to do Zoom, I'm going to make myself do it so that I can stay connected. Or
Right.
that phone call that I feel like I really don't want to do. But if I want to push through this a little bit, I need to just push myself to do it. So all the things that you said, Larry, I think is so great. And then we need to then tell ourselves we need to take that extra step during this time because it's so hard.
Thanks, Dickie. Laura, I don't know if you had anything to add.
Sure. I think partly it's remembering that you're not alone in feeling this. and, making the time for other people. And also because we have all these many people have all these electronics now, to be able to kind of reach out to people that you might not have in the past that are across the country, or people that you haven't, spoken with in a while. At the same time, your neighbors are, if you're out walking, it's a chance to get to know people who are right in your community, who are obviously, dealing with some of the same things. And, again, kind of keeping socially separate with masks on, but it's an opportunity to kind of get to know other people as well.
So that it's what I'm hearing from people is really is the push. You have to push yourself.
Absolutely.
Right. Thank you, Laura. And Laura's from the Community Health Center of Cape Cod. And Terry Ann from Family Continuity. Terry's the director of the Family Resource Center. Terry, I don't know if you have any suggestions for families about maintaining social supports during isolation.
Yeah, everyone has said, so, specifically where we would go to. So really pushing yourself, maintaining your current social context. But I love what Laura just said, really looking for new social contexts too. And so we at the Resource Center, the Cape Cod Family Resource Center, we're often speaking with families about what was currently in place, how they can continue to maintain that just in a different way. So some great suggestions this evening already. We really try to encourage folks to get outside as much as possible. We've been speaking to a lot of folks about looking for those opportunities when the weather allows to get out there and because just the fresh air and whatnot. But in addition to, as Laura was just saying, is look for new opportunities too. So we often love to share with families other Zoom ideas that maybe they hadn't thought of before. So other social or support groups or just family-friendly activities. There's a lot on the Cape now. We've had a year to build these all up. So there's so many organizations and agencies across the Cape that are providing a tremendous amount of wonderful programming for families to get involved with, so that maybe you're meeting new folks. You're just doing it in a very different way, and there's usually an activity involved with that, and they're very age appropriate depending on your family makeup. So I think that they're reaching out, and that's been the message here too. So really reaching out and utilizing the resources around you on the Cape, and just simply by starting and making a phone call or an email to any one of us here on the Cape, and we'd be happy to help support families.
Thanks so much, Terry Ann.
And Beth, if I may mention, we've also, through the MassSupport program, we've been running something that we call coping groups. And we've been invited into a number of schools, nursing homes, to work with staff, with residents, different workplaces, to run these groups. And what a coping group really, it's kind of what it sounds like. We go around, we ask a series of questions of people about how they've been reacting. We do a little bit of education like we've been doing tonight, and then really talk with people about developing a self-care plan. And this has been something that's been really, I think it's been welcomed. That is probably one of the services we're doing the most of these days, as people have been learning about that. We've been getting more and more requests for those.
Thank you. We do have a question here, and a comment, thanking us for the very good ideas and tools. How do people get more of these? And I will say that the coping during COVID, we have a website as part of the Cape Cod COVID-19 task force that is full of resources. And I will put the link to that in the chat as soon as I have a moment. But I don't know if anybody else, either Larry, your team, how do we get these tools to more people? Just anybody have any?
Yeah, Colby, do you have any ideas on that? Don't want to put you on the spot. But...
Yeah, no, absolutely. A lot of people these days are using smartphone technology or iPads or computers, or they're working from home, so they're on these devices more often than not. We have a YouTube channel where we publish different videos on different coping skills and techniques. We have some that are dedicated to mindfulness. We have some that are dedicated to grounding techniques. some more practical skills, also like new activities people can try. I know there's one like on skylining, which is really cool. Our Instagram, our Facebook, our Twitter, we repost things all day long, things going on in Massachusetts, up-to-date information, but we're constantly sharing these coping skills on our social media. And I think that that can be a really practical way to sort of share them. You know, if you see something, you could share it with a friend, share it with your mom, dad, anybody in the family, because it's so easy to share and it's so practical.
All right. I'm actually looking for the, I should have the website for that, but I don't. I'm going to take me a minute. Oh, right there. Liz put it on there. The Facebook, and then I'll also put up the one for the COVID, Coping with COVID website. Let's see what else. We did had a comment about how difficult it is, very lonely living with a spouse who is diagnosed with mild cognitive loss. And there's been some back and forth in the chat. I'm not sure if anyone has anything else to offer as far as advice for a spouse who is living with someone with mild cognitive loss, and how, what assistance might be out there.
I would mention, Beth, the Alzheimer's Family Support Center has really wonderful caregiver support groups at, I think, most of the COAs here in Falmouth. It's at the Falmouth COA virtually. And they provide support for caregivers that are caring for someone with not just Alzheimer's, but any type of cognitive loss, cognitive decline. So I can put their website in the chat for anyone that wants to check that out.
Excellent.
Yeah, that'd be a great resource. And the Department of Elder Affairs for the state has a whole network of supports they have for caregivers, right, who are taking care of older adults or family members who have some kind of disability. And we've actually been providing some regional coping groups, all virtual, online, for those folks as well. That's another resource. And one of the things that we've been doing is trying to help those folks. You know, our funding will only last so long, but we're trying to help those folks by training them on how to create their own support groups among, you know, the folks who are our caregivers for people, so that you can build support groups among yourselves. So that's something, you know, please reach out and, you know, call us. We'd be glad to talk with you about some ideas about how to do that too.
Okay. Oh, there's a couple things coming in. So let me, they're coming in quickly, so I have to read through them. Can you talk a little bit about helping people who have difficulty reaching out for help because they see it as a sign of weakness or shame? Who would like to take that one?
You know,
Oh, Larry?
well, I don't want to hog the hog the mic here,
Larry,
but
you start and then I'll turn it over to Dickie.
okay. You know, I talk about this and think about this a lot in terms of men asking for help, because men often, as a bad stereotype, are less likely, I think, to ask for help. We actually at the Trauma Center have a whole program called Mass Men, which is focused on trying to help men get supports that they might need. And you know, they're two that I think as we practice it and do more of it, people will be more comfortable with it. But there is this social message that somehow there's a weakness. I often ask the question, like, you know, to someone, if you had an incredible headache that just wouldn't go away, you know, you had a migraine that was lasting for days, what would you do? Of course, you'd pick up the phone and get to a doctor and get some help, right? Or, you know, abdominal pain. We say this to teenagers in high schools all the time. You know, if you had a stomach ache that was just killing you for days, what would you do? You'd go to the school nurse, right? So why is it, if we've got this debilitating anxiety or feeling overwhelmingly depressed, we won't reach out and help? What's the difference here? Just to get the conversation going and talk about it. We need more role models. We need more role models like Senator Sayre, who at the beginning is saying, yeah, I was struggling with stuff and I asked for help. We need, there's some great videos out there, and we need more of this. Like one of my favorites is Michael Phelps, you know, the swimmer, the Olympic swimmer, who's arguably one of the greatest athletes, more Olympic medals than anyone. There's videos of him talking about his experiences with depression and anxiety and addiction, and how he got help, and it literally saved his life. He went to counseling and got some help for that. we just need more role models talking about this and helping people understand that actually it's a sign of strength to reach out and try to get help. So just, but please, others, I'd love to hear other people's thoughts on this too.
Yeah, thanks, Larry. Dickie, do you have anything you'd like to add to this about people who have difficulty reaching out for help because they see it as a sign of weakness or shame?
Yeah, I mean, Larry, you really covered it, but I think that for us as clinicians to also be able to be open to our people that we talk to, as I worry sometimes about things and I have a hard time reaching out, to sort of normalize that it is hard to reach out. It's not just them, that this is something that, we are stoic people. We live on the Cape. We are strong people, and being able to sort of normalize that reaching out is hard. We're kind of showing other people that you have some struggles is a hard thing to do. So we just need to try to be real with people and recognize that I have problems reaching out, and so do you.
Thanks, Dickie.
Can I add something?
Yes, Lorraine.
Thank you. So with regards to the stigma and people having difficulty reaching for support, I would probably add, but on a different lens with regards to food access support, working for DTA, we do manage the SNAP program. And one of the things that we've struggled with is that stigma that's tied to assistance for SNAP, and trying to encourage people to reach out and get that help, because it's something that is available for all of us in Massachusetts and across the country. We are, it's a support that's there to help you while you're temporarily going through hardship to food access. So I think that's also another one of those things where we have difficulty people reaching out. And now with the current high rates of food insecurity, especially in Massachusetts, we have the flexibilities that we've received on the program. We are able to issue maximum benefits. These regulations have been kind of limited a little bit with regards to getting access. In some occasions, we don't even require an interview. I always say, if somebody offered, especially right now during COVID, we have households can maximum, household of 2, you have $600 a month to supplement your grocery bill. That's something that you don't have to stress about, thinking about when you'd be able to where you'd be getting the supplemental income to cover groceries. So, one of the, not to repeat myself a little bit, is just that the stigma that goes with SNAP is a big thing for us that we want to overcome, and have people look at it as getting that help that you need, and that's what it's there for.
Thank you.
It's like
Nice.
any of the services.
Yeah, thank you.
Yeah. Hey, Beth, one other resource too that I want to mention. We're saying, we're trying to encourage people to speak up, reach out when they need help. Not all people will. They don't feel comfortable. Here's one other resource. On the MassSupport website, we actually have a link to a series of screening tools that people can use. It's totally anonymous, totally on your own. So if someone's uncomfortable and they're wondering, is what I'm dealing with a little more than just day-to-day stress? Is this really maybe a sign that there's something more going on? That we have screening tools there around, I think it's 13 different issues. So depression, anxiety, substance use questions that people can go through and fill out, these questionnaires. And if it looks like that maybe their responses are consistent with something that might show a problem, it gives them resources too, places that they could follow up with. So for people who are reluctant, that's an anonymous, private way they could also get some information.
Thanks, Larry.
Beth,
I want to bring in
a comment, Beth.
Yeah, go ahead, Susie.
Sorry, I just wanted to piggyback up on what Lorraine said too, and just recognize Cassie Danzel from Hack and
that's where I was going.
Oh,
that's
good. And just the overwhelming stress that folks are feeling if they're feeling insecure with their housing or running behind in their rent. And Hack's message is really reach out sooner than later. They have a whole host of services and financial assistance. And maybe I'll just turn it over to Cassie to say a couple words about how she can help in that way.
Thank you.
Sure, that's a great point, Susie. I think one of the things that we're seeing is, Larry talked a lot about stress, and one of the things that's happening is there's pretty dire financial stress out there with the economic impacts of the pandemic. And we have a whole host of programs available to help people who have experienced a pretty drastic change in income in most cases, to help pay their rent, their mortgage, possibly utility costs. All of our programs are available. We are noticing a lot of folks who have never accessed any type of resource before reaching out, which I think is a great sign. But anyone who is hesitant or feels as if there's some sort of stigma, this is exactly why these programs exist. And we're here to help the community and our region make sure that nobody ends up losing their house as we're all, trying to stay home and trying to stay safe. And it's one of the ways that we try to connect with the community to make sure that we come out of this in the same space that we went in. So please reach out. All of our applications are online, they're confidential. Nobody is ever going to know that you received a benefit through us, and we can work directly with households who need assistance.
Thanks, Cassie. That's great. And everybody can see the screen with all of your contact information up there for our local experts. So thank you for that. And thank you, Lorraine, for jumping in. I was going to try to weave you two in. It's difficult. But I really appreciate you spending your evening with us. So thank you. A couple more questions. How does COVID impact people with OCD, and how can it be treated? So who would like to take that question? Larry?
Larry, that's all you.
Well, that's absolutely a tough one. People who are anxious to begin with, people who are, very concerned about cleanliness or germs and health issues are obviously we're all having a challenge with that, right? So that may be making it even more challenging for someone who, you talk about obsessive-compulsive disorders, especially if if it's something focused on issues around germs or cleanliness or health issues. And I think the best thing to do is there's some online self-help resources that are out there, and counseling. I would encourage people to really connect with a counselor who could help. There's some great places, the anxiety clinic at Boston University, the program there. You folks on the Cape, I'm sure some of you at the mental health centers could talk about what's on the Cape or the islands, but that's, it's often best treated by a combination of sometimes medication and sometimes counseling.
Thanks. I am going to ask Laura if Laura has anything to add to that, and then Dickie before we move on to the next question.
Yeah, I was thinking kind of about the combination actually of someone with OCD and the kind of weakness shame factor, because I was thinking in all of our community health centers, nationally, but also on the Cape, we have integrated services. So going to your primary care, you may feel more able to do that. And we have behavioral health services, which are very connected to each of the medical teams, which normalizes it and hopefully takes away some of that stigma. And you can go in there and nobody knows why you're there. And it's a way just to get some services that aren't, where you can be somewhat anonymous as well.
Well, I was going to say, we're so fortunate on the Cape. We have such amazing community health centers, and I'm always so proud to work with them. So we have Dickie too from Outer Cape. I don't know if Dickie, if you want to add anything else to what Laura or Larry has said about OCD and what people are going through with.
No, I would just ditto what both of them are saying, important things, and just the important piece is to recognize that you shouldn't sit alone with this, because this is an awful feeling when you are feeling so anxious, and to please reach out. There is help in this, and the combination, like Larry and Laura was saying, combination of counseling and possibly some medication can be really helpful. So don't hesitate in reaching out.
Thanks, Dickie. There's a question here. Some of us have lost family members during COVID. It's been very lonely since we can't get together? Is there grief counseling? And I guess first from a MassSupport, you know, the 800 number what do you do when someone calls that needs grief counseling?
Is there Kovid? Do you want to take that? Or?
Go ahead, Larry, or who? Liz?
I can take that. So we are available to speak to them. But again, we are offering coping groups for this. And they are listed on our MassSupport website on Facebook. And we have held several coping groups that have been extremely beneficial for individuals that have lost loved ones during this time.
Okay.
Yeah, and I just want to say, I'm sorry, for those of you who have lost friends, family, neighbors. This has been really hard, and it's a really sad time. And you're absolutely right. That lack of, all of our grieving rituals are about people coming together, right? And literally touching each other, hugging, being together, and that has all been disrupted. It is really, really challenging. So, but again, that social connection, right? Making sure we're doing our best to use Zoom, to stay on the phone, to connect as best we can with those family members. Now's the time to, call that cousin you haven't talked to in a long time and call them again the next week too, to keep reaching out.
So I just want to, there's been a question in the chat about outreach to seniors as far as the vaccination. And I'm going to direct people back to the Barnstable County COVID-19 helpline for that, because we could spend quite a bit of time talking about outreach efforts and what's happening. And there's going to be, I think there's going to be some announcements made over the next couple of days about some things that are underway, but it's a constant topic, and it's been very, very challenging. But this is a really interesting question. How do you cope with individuals who deny the severity of COVID-19? Who would like to take that? One of our mental health professionals. How do you cope with individuals who deny the severity of COVID-19?
I think partly it comes back to self-care and kind of how you need to take care of yourself during this time. You can acknowledge that you have differences if you are one that does believe in the coronavirus and what's happening. And I think there's definitely differences around people who want to get the vaccine or people who don't want to get the vaccine, and how to acknowledge that, again, that there are differences, and that you disagree, and that's okay. You can also help people get informed if they're open to it. Refer to some websites, ask them, and engage in a conversation about it. I mean, there's a lot of differences in the world these days, obviously. And again, I kind of come back to what Larry and Dickie were saying about connection and good communication and coming to a level of understanding. Also, what's behind the kind of not the disbelief? Is there fear that's kind of understanding what the feelings are that are underneath, and why people are sharing what they're sharing.
Okay. Dickie, do you have anything to add about coping with individuals who deny the severity of COVID-19?
I think this is when we are talking about what we can control and what we can't control. And so we can't control other people's thoughts and feelings. And so we could try, but we shouldn't get too wrapped up in it.
Okay. Any final thoughts on that, Larry?
Yeah, no, I think you've said it exactly. We have to let go of that. We can't get in fights with people. It's as effective as getting into an argument about politics at Thanksgiving dinner. It just doesn't work. I think you can you're right. Just state your own opinion, state that this is what you're doing to stay safe. You're looking at all the science, the media, and making your decisions. But right, I would say, yeah, you can't let yourself get wrapped up in other people's opinions about that.
Okay. boy, I'm continuing to get lots of movement here in the chat. So I can't keep up with all a lot of the comments and questions, but someone suggested seniors having difficulty. There's a 211, or there's another number. Let's see.
Beth, I was going to chime in and notice the question on, can anyone speak to peer support resources on the Cape for both mental health and substance use? I would direct people to the Coping During COVID county website that you've already posted in the chat, and there's different categories. I know for recovery supports, there's all kinds of lists for virtual groups, and here in Falmouth, there's the Well Strong recovery gym. And I think there's more information on the Coping During COVID page as well. And also NAMI of National Alliance for Mental Illness, Cape Cod. I don't have that at my fingertips, but that would also be a good resource here on the Cape.
Thanks, Susie. I would also, in response to that question, there's a lot of substance use related resource information on the Barnstable County Human Services website as well, which is bchumanservices.net, which I'll also put in the chat. But there's certainly a lot of listings of different resources.
Okay, and just so you know, actually on the MassSupport programs on our teams, we do have some of our staff are recovery coaches and some are certified peer counselors. So that's something someone could specifically ask for when they call.
Yes.
Very good. Good to know that. Right. I think there's been a lot of kind of going back and forth thing. I'm not sure I've missed any questions though. One comment was grief extends beyond loss of loved ones to the loss of life as we've known it. So that bigger question. There's some really bad.
Yeah.
That's yeah. So just that acknowledgement that grief extends beyond the loss of a loved one.
Such a good point. We often refer to that as ambiguous losses. So the kids who didn't get to go to their high school graduation, they didn't get to play that final season of soccer or something. The weddings that were planned that didn't get held. All these things, you're right, are just our routines. Going into the office and missing the socializing and having lunch with our coworkers. There's absolutely, and those have to be acknowledged as losses. Yep.
Okay.
Hey, Beth, I don't know if you noticed, there's also in the question and answer section, somebody was pointing out that families and seniors can access activities during the pandemic at libraries and at the Barnstable Senior Center. So other great resources.
I wasn't even looking at the Q&A because I've been so focused on the chat. It's a little confusing going back and forth. Susie, my partner in crime here, monitoring the chat. Is there anything that we missed?
I don't believe so. I apologize for having my camera off. I've just been looking at lots of different places, but I think we've gotten it all.
All right.
There was one comment from someone who's experienced a significant mental health crisis with an adult child and the challenges of that. I was going to again mention NAMI. It sounds like this person, I'm assuming, might be know enough about some of the local services, but that too during, I imagine is very, very difficult to have to be caring for someone with chronic mental illness. And, it's probably a much longer conversation. I would invite that person to call MassSupport and start to kind of maybe get some ideas and troubleshoot around what some of the local supports that maybe they haven't tapped into. And I know all of us here on the call would welcome supporting in that way. So
yeah, thank you for mentioning that. So I'm going to start to wrap up. I think I don't see any new chats. First, I want to thank Larry Berkowitz from Riverside Trauma Center and his team, and Liz Rico and Colby and Greg, who's behind the scenes, who has been just been amazing to work with and helping put this on. So big thank you to Larry and his team. Also a thank you to our local expert panel, Laura from the Community Health Center of Cape Cod, Laura Cantor, Dickie Hansen from Outer Cape Health, Cassie Danzel from Housing Assistance Corporation, Lorraine from the Department of Transitional Assistance, really nice to meet you, and Terry Ann Moran from the Family Resource Center, which is a great resource that we have, very fortunate to have on Cape Cod. So thank you, local experts, for hanging in there and for being here to help with this. And thanks to Susie. Did I forget anyone? Oh, and Sonia Sheasley from the county has been behind the scenes helping with this as well, getting the word out, putting out press releases, etc. So I just want to thank everyone who was involved. I think this has been very successful. We had quite a few participants and some really great feedback in the chat. So thank you all very much and have a good evening.
Thanks for having us.
Yeah, thank you.
Take good care.
Take good care.
Bye. Thank you, everyone.
Bye. Thank you so much.
Bye.